Ahead of the provincial budget being tabled Thursday, Premier Jason Kenney reiterating that some surgeries will be contracted out to private facilities, and that has some critics worried that will lead to further privatization.
Surgeries. Unfortunately, the progress on the surgical initiative has been delayed because of COVID pressures, which have, of course, added to surgical backlogs.
The Premier points to the pandemic and the previous NDP government as the source of the surgical backlog, adding there will be more coming in the provincial budget to address that. The opposition NDP say every dollar invested into private health care is a dollar not spent on maintaining a healthcare system for Albertans and doesn't address staffing shortages.
Opening more private surgical facilities is not going to magically make more anesthesiologists appear. Like in Red Deer, where they lost a number of anesthesiologists who retired or chose to leave the province or went to work in other cities because of actions taken by this government.
Public health care advocates Friends of Medicare agree, telling me increasing funding for private health care now can create a dire situation later.
Look at Australia or other places. Once you do it, you're giving up control, you're giving up the ability to shift your capacity. You know, in Australia during COVID, you saw the government having to pay billions of dollars to private hospitals to use their facilities during a crisis because their contracts weren't for what they were being used for.
In Edmonton, Darcy Ropchan, City News.